welcome to the Disc Golf Doctor. Today we're going to talk about preventing knee injuries. There's a million different things we could talk about here, and even in the research there's lots of debates as to what factors contribute the most towards knee injuries. Plus, when you're talking about various knee injuries, there's many different things that apply. So if we're talking about ACL tears, that's different than if we're talking about patellofemoral issues or if we're talking about meniscal tears. I think what's most pertinent for disc golf is meniscal tears because of the rotation we put through our legs, and that's often what contributes to meniscus tears is when you have a compressive load and a torsional load on top of that. And so that can very easily happen in the disc golf throw if we're not careful, if we don't have sufficient mobility and sufficient strength and proper form. So we're going to talk about four main things today to focus on to help prevent knee injuries going forward. When talking about injury prevention of the knee, what's most important is what's happening above and below the knee. Those joints are really critical for what happens at the knee when we do dynamic motions. Studies have really shown that you don't want to focus so much on things in and around the knee. It's more these other joints that are most pertinent to preventing injury. So when you look at the hip, rotation is an important thing in disc golf. The hip can rotate both inwardly and outwardly. If you look at the thigh, whichever direction that is in relation to our trunk, or really our pelvis, is whether it's internal rotation or external rotation. And this is true for whether it's the hip and the leg moving or the body. Right? If I have my leg here and I rotate my pelvis away, my trunk away, this is hip external rotation. The anterior portion of my thigh is rotating outwardly, external rotation. And I'm rotating my body inwardly, this is hip internal rotation. People don't typically almost ever have limitations in hip external rotation. Even people with extensive hip osteoarthritis only have small degrees of changes in how much hip external rotation they have. It's hip internal rotation that very, very many people are limited in. And there's a few different reasons for that. But the reason it's pertinent to disc golf is when we go to take our backhand throw, as I'm coming here, my hip is in somewhat neutral, if not externally rotated position, particularly as I reach back, it's actually going to be externally rotated. As I come through and throw, I need some hip internal rotation here as my pelvis rotates through here as I'm throwing. And I need to be able to clear my foot. We'll talk about that in a minute. But we need to have the range of motion in our hip to be able to rotate our pelvis this way while still keeping our thigh relatively in that same position we're in until that foot's able to clear. Because if I don't have enough hip internal rotation, all of a sudden my knee's going to start getting some of that rotational torsional force, and that's what's going to cause some of these problems if I don't have enough motion coming in through here before my foot starts to turn. So you may end up having to pivot your foot too soon, so maybe you will even prevent those injuries, but you're not going to get as much power if you don't have enough range of motion to rotate your pelvis on your throw before you have to move your foot. One of the two exercises we're going to do for stretching is stretching out your hip flexor. It is one of the most common reasons people are limited in hip internal rotation and definitely hip extension, both important motions to have. There's a bunch of different stretches out there. I'm going to show you probably one of the simplest ones, the best ones for positioning everything correctly. And there's one common thing people almost always do incorrectly, if not consciously focusing on it. One of the best ways to do it is to be kneeling on one knee and have the other foot up here like so. As I come forward, just to lengthen that hip flexor, okay? Oftentimes people do exactly this. See how arched my lumbar spine is, my lower back? This, I am just getting all this extension of my lumbar spine, and I'm not lengthening my hip flexor as much. I may be even putting some strain on the anterior hip capsule in my hip. So what you really want to focus on is squeezing your glute muscle and doing a posterior pelvic tilt. If you remember one of those first episodes when we went over the pelvic tilt exercise, that's the same motion we're talking about. We're flattening out the back so it's no longer in this arch position, it's neutral, and I'm engaging my glute muscles. Even right now I feel some tension in my hip flexors. Mine are a little bit tight, and most people, you don't really need to go very far. All you need to do is accentuate by coming forward a little bit, and that's plenty tight in my case, right there. You see lots of people not do that, and they say, oh, look at all of this motion. I don't have tight hip flexors, and stretch all day. Well, it's because you're getting the motion in other places in your hip flexor. Flatten out your back, squeeze the glutes, come forward a little bit. You probably don't need a whole lot to really get some tension. You want it here in the front part of the hip, not so much lower down here in the thigh. Not that that's a bad thing, but we're not looking to stretch the quad, we're looking to stretch the hip flexor. I can hear now people saying to themselves that the hip flexor doesn't have anything to do with hip internal rotation. It just flexes the hip and would limit extension. Yes, it does limit extension, but if you look at the muscle here, you can see it's the longer muscle here shown. The psoas muscle attaches within the pelvis along the ilium, and iliopsoas there comes in and attaches into the hip. But the hip flexor is the one that comes up and attaches to the lumbar spine and comes in and attaches into the femur. And you can see it doesn't just come down and attach in the front part of the femur, but it rolls around and attaches in a different angle. And because of that angle, it will definitely roll the hip into external rotation and therefore limit the ability of the hip to internally rotate. So I guarantee you hip flexors limit how much hip internal rotation people have, and it obviously limits hip extension, which is a motion that's important to have as well for normal gait. So now we're concerned with what is the foot doing during the throw. We've talked a lot about the initial footwork where you're planting before you throw, but we haven't really talked too much about what happens as you're coming through with regards to your foot and when do you start pivoting, because that's what's going to get people in trouble. Some people don't realize that once you're here, once you're planted, you can't just keep the foot there, because if you keep your foot rotated here, you're going to be twisting through your knee, and you're really going to aggravate it pretty quickly. What's critical is getting in this position, planting. You could talk about for days about debates on how to have your foot, whether it's initially landing on your toe and then your heel, or what angle, whether it's neutral or even slightly back like that. We're not going to get so much into that. But once I'm planted here, as I'm following through, rotating my hips, I got to make sure I'm spinning through on my heel. Right? You see a lot of people land on their toes, then they shift their weight to the heel, and you'll see a lot of the pros, their toes will kind of come up in the air and they'll spin on their heel as they come around. You got to make sure that foot clears, otherwise you're getting all that torsional rotational force through the knee, and that's what's going to cause some of those meniscal tears. One thing that's important for protecting your knee that most people wouldn't think about, because it doesn't apply directly to the throw, is having enough ankle dorsiflexion. Ankle dorsiflexion is this motion of my ankle, my ability to step and do this as I stride forward. The reason why it's really important, even though it doesn't have to do with our throw directly, is many courses you go to are very hilly, you're walking for long durations of time, and we see plenty of people with knee issues that didn't do anything traumatically. It wasn't a big twisting motion, it wasn't a fall, but it was something slowly over time. So if you're going to be walking for any duration of time, and particularly if you're adding compressive load like a backpack with discs in it, you want to have good motion in your gait, good motion in the ankle. Because if I don't have enough motion here, my heel's going to come up early, it's going to shift that weight onto my knee sooner. It's going to put a lot more strain, and oftentimes we see other abnormal mechanics that people compensate with. People often will be more externally rotated because they don't have the ability to come over the ankle, they don't have the motion there, so if they externally rotate, they end up rolling their arch, kind of their foot, into pronation, and they end up stepping more like this because you don't need the same amount of dorsiflexion if my foot's rotated out like this. So it applies directly to a lack of hip internal rotation. That's why it may be good to be stretching both of those things, because one can easily affect the other. If I naturally walk with my feet turned out like this, I am going to have not only some of the tightness in the ankle, but it's going to lead to lack of hip internal rotation because I'm constantly in external rotation. So if we can affect the way we're walking and have that better, inherently it's going to keep our knees healthier as we walk and not lead to these issues compounded by these abnormal ways that we're throwing. The other stretch we're going to do is a gastroc stretch to increase that ankle dorsiflexion we talked about. What you want to do is find a wall, or you can use a countertop. Have 1 foot back and 1 foot forward. You want this back foot to be nice and straight, not turned out like most people tend to do. Foot nice and straight, and keep your heel down as you lean in towards the wall. You can let your front knee bend as you're leaning forward until you feel a stretch in your calf. I'm going to hold that for 30 seconds. I'm going to do that 3 times and try that a few times a day. One other version you can do is a stretch for your soleus muscle. You can let the back knee bend a little bit, 20 to 30 degrees, and I'm going to lean forward until I feel a stretch a little bit lower down in my calf. You may need to bring the back foot closer to the wall to begin with to get a good stretch, but it is a secondary stretch you can do as well. One other thing that is very important for the health of your knees is glute strength. We mentioned it before, your knees are really dependent on what are happening above and below it, not so much what's happening at the joint specifically. So the muscles in the hip really control the positioning of the knees. You see this particularly in females. You see a lot of ACL tears because of this as they land or they go to stand up. You see oftentimes the knees come in like this as people are landing. And because of that, the reason for that is strength in the hip. Part of it can be anatomical if there's a different angle of the femur in relation to the pelvis and the angle of the neck. But a lot of it has to do with strength of some of these glute muscles and the external rotators to keep the knees more in line. Because if I start getting offline in any particular direction, automatically it's putting too much strain on certain structures rather than spreading those forces out naturally across the joint. So if we can get some of these hip external rotators and abductions this direction, it's some of the glute muscles really in particular, if we can strengthen those, that's going to help protect the knees. So I'm going to put a link up for the lunges video that I put out, so you can take a look at that. One other version of the lunge that we didn't go over that would get some of those hip abductors a little more directly would just be a lateral lunge. In the video before, we went over a sagittal lunge, which is straight forward and back, and we went over a transverse lunge, which would be good for those external rotators, so particularly pertinent for what we're talking about here. But you may want to work on something where it's just a lateral lunge, where I'm stepping sideways here and then coming back. It's going to help kick in particularly your glute medius, but it really is going to get a lot of different muscles as I come back and forth like this. Just like with the other lunges, you don't want your knees to come in front of your toes. I'm really sticking my butt back like that, like I'm going to sit in a small stool off to the side as I'm coming back and forth, and I can do the same thing on this like here. Making sure that I'm really stacked here where my hip is right above my knee is right above my foot, and not letting my knee come too far forward. Please keep in mind that when I suggest that you need to have enough motion to do something properly, that does not mean you necessarily need to purposely try to exaggerate that motion in the throw. So when we talked about the thoracic spine the other day, just because you want to have enough thoracic extension and thoracic rotation doesn't mean you want to force rotation through your spine as you're doing your throw. It's not something you should be thinking about. It should happen naturally. We want to just make sure you have sufficient mobility so that when you rotate, you're getting it in the right spot. Don't think about it. Same thing comes with hip internal rotation. You watch different throwers, different pros. They all have different amounts of hip internal rotation before their foot tries to clear. I'm not trying to say force your hip into internal rotation before you're clearing your foot. I'm just saying have enough mobility in your hip so that the natural hip internal rotation can take place rather than putting the strain on your knee. Just let it happen. Don't focus on encouraging it. So there's really a million different things we could talk about, like I said earlier. These are just 4 things to focus on. I'm not saying it's comprehensive or there's not other issues that are pertinent. I'm going based on what we see in the clinic day in and day out and what a lot of the research tends to show. A lot of the research does show that things vary from person to person. These are 4 things that are very commonly seen, and you really can't go wrong working on them as long as you don't have pain while doing the exercises. One other last thing to consider that I didn't put in the list would be having proper footwear. We do see a lot of people who are overpronators. That means that their arch really flattens out and rolls in as they step. Not that everyone is, but it's a common thing. And having enough arch support in your shoes prevents your foot from rolling in and therefore from your knee following along with it. Again, we said your knee is dependent on what's happening above and below. If your foot's rolling in, your knee is going to come in into a valgus direction as well and put strain on the knee. So if you have any good running stores in your area, that's what I would suggest. A place that would watch you walk, analyze your gait, and give you a good few suggestions on shoes that would match your gait in particular, oftentimes is the best thing to be wearing. Thanks for joining us for the Disc Golf Doctor. Please let me know if you have any questions, thoughts, ideas going forward. Thanks.